I'm Debi Schneider. I'm a physical therapist with Memorial Hospital. I've been doing women's health issues for over 20 years. I'm certified manual lymphatic drainage therapist, and I've been trained in various classes related to pelvic health.
So I'm a physical therapist here at Memorial Hospital. I specialize in treating patients that have issues with pelvic floor dysfunction. So the pelvic floor is a group of muscles that sit in the lower pelvis. They aid in urination, defecation, and sexual function, and they also help to support the pelvis, the hips, and the low back.
With women's health issues as they address to physical therapy, we are experts on exercise. So if someone has had any issues with breast health, generally we want to focus back onto what are the muscular issues, what are the postural issues, what are the body mechanics, things that we can address physical therapist-wise. And same thing with incontinence. We're focusing on the muscular aspect more so than other things that the doctors might focus on. So what can we do exercise-wise to get rid of pain? What can we do to decrease the incidence of incontinence? What can we do to improve sexual health?
Sometimes patients can come to me with issues where their pelvic floor is weak. So these patients may complain of leakage of, say, their urine when they cough, laugh, sneeze, jump, or exercise. Some other people may have a more upregulated pelvic floor that's kind of overactive. And those people may be complaining of issues with pain. So they may have pain in the pelvic region, or pain with intercourse, or even pain with just sitting for too long, standing for too long, or any activity that they do throughout their day.
So we definitely, on both aspects, whether it's breast health or pelvic floor health, we're dealing with the muscular aspect, the day-to-day living, returning people back to their normal activities that maybe they could not do. A lot of women are restricted in going out because of incontinence. They're afraid to. So is this something we can do muscular-wise? I have a lady coming in now that can no longer fish, which she wants to go fishing because of her breast surgery. She doesn't have the ability to do that. So we're dealing on the muscular aspect of those different areas of the body.
So the first thing I'll do will be very similar to anybody that comes in with, say, low back pain. Because the pelvic floor muscles sit within the pelvis, I'm going to look at the alignment of their pelvis, I'm going to look at the alignment of their spine, and I'm also going to look at the strength of their core, their hip girdle muscles, and then also how they breathe, because there's a close relationship between the pelvic floor and the muscles that you use to breathe. From there, I will also typically request that I do a pelvic exam. The reason for that is that the pelvic floor muscles are located within the pelvis, and that's the best way for me to find out what's going on with them. However, if the patient does not want me to perform an internal exam, that's not a problem. I have other techniques that I can utilize as well.
It is probably the most rewarding part of my life that I've had since entering into physical therapy. The breast cancer patients have such a new look out on life that I learn from them daily. The incontinence patients, they are suffering from unable to get back to regular activities, to return them back to bigger levels of doing things they want to do. It's just, again, very, very rewarding.
These issues that people come to me with are issues that they're afraid to talk about. They're things that they're embarrassed about. They think they're alone. And so to be a listening ear and to be a guiding voice to let them know that they're not alone and they don't have to live with these problems, and that there are things that we can do. And to be able to impact their life on such a personal level makes it even that more rewarding, because you know that you're not just taking away pain, you're changing their life.